Hi, I'm Dr. Mark Jagger, creator of The Spine Specialist, answering another one of our frequently asked questions. So, from time to time, I get the question, Doc, I see other clinics doing laser and spinal decompression separately. How is that different from what you guys do? Well, the short answer is that no device on the planet, besides the spine specialist, actually performs simultaneous robotic, class 4 laser therapy, and spinal decompression together. So there is no other device capable of doing the treatment the way that we do it with the spine specialist. Now, that's very important. That process is patented. There is a specific protocol that goes along with the way it is done. So over my number of years of experience, we've found ways to do this that get us the best possible results, and utilizing essentially a few mechanical principles and a few things that I observed throughout treating with laser therapy and decompression that I combined to make my results that much better. So kind of like a professional athlete who knows, how they can move and what they can do, and these little tweaks that they can do with what they are doing with their performance that will improve the results that they're getting. So this is no different with respect to the practice of laser enhanced spinal decompression. So where my history is, we were actually one of the very first offices to ever do any type of treatment protocol like this, combining laser and spinal decompression. I actually came up with a therapy protocol called laser enhanced spinal decompression. Now, you'll see that term used all over the place. So a funny story about that is I created a educational source for patients on my website, and actually just predating about 2007 when we started doing laser and decompression. Within about a year, I started seeing my website text exactly copy and pasted to a number of websites all across the continent and a few other places beyond. At first, I was a little upset because people had taken my copyrighted content that I had written and copied and pasted it to their own website. Some of them even used the same pictures that we used. It would be almost a duplicate of our website. Now, what I started realizing is that flattery is the most sincere, what's the phrase? Imitation is the most sincere form of flattery. That is the way I took it. And I thought, wow, you know what, we're really onto something. And why should I hold on to something, like that, where it could help a lot of patients? So, I never really fought back on any of that stuff being copied with respect to our website content. Now, we've patented the device. That's a whole other ball of wax there, but and patented the protocol that's used. Now, why is it different? Why is it better than what we were doing before? Well, simultaneous class 4 laser, and decompression. We take the laser and we take the decompression and we do it together. The advantage of that is that laser softens and relaxes muscle tissue and relieves pain and reduces inflammation. At the same time, we stretch all that out. So if you're relaxing in the muscle tissue that's tight at the same time as you're stretching out, it works a whole heck of a lot better than doing it while the muscle's tight. And if you're trying to pull on a tight muscle that won't relax and that is inflamed and that is sore, it's going to get reflexive spasm and it's going to fight against you. It's not going to be comfortable for the patient, and it's not going to be as effective. So what everyone else is doing without doing simultaneous laser, they're essentially trying to pull on muscles that are painful, that are spasmed, that it's really not going to get the same result as what we're getting with the simultaneous laser and decompression. The second thing is, we found dosage of laser is something that is very important, and uniform dosage of laser across the tissue. What I mean by that is, if I'm doing laser by hand and I'm treating this area, and I go about this fast with my hand here, and then I go faster here, so I get, 30 seconds of laser in this area, and then 10 seconds of laser in this area, I have an ununiform dosage. So what laser does is it actually helps dilate the blood vessels. So if I dilate blood vessels really nicely here, but then the blood vessels are still a little constricted here, the bottleneck, it's kind of like a funnel. The bottleneck of that fluid, if I'm trying to clear inflammation, if it's not a uniform dose, the blood vessels aren't large enough to, if they open here and they're a little closed here, you can't get all the fluid out. You can't get the inflammation out, and you're not giving a uniform dosage of tissue if you're just doing it by hand. What the robot does is it allows the dose to be absolutely consistent. It moves at a consistent speed, it moves over a consistent pattern, so I can uniformly dose all the tissue that I'm trying to work on so it gets the same dose. Second thing is I can target the tissue. So if your problem in your back is down here, spine, problem in the back is down here, and I get the laser to do everything, and then I program it to actually come back and treat exactly where the problem is, to do a little double dose, then I actually can focus on one area, which is something that no other decompression table on the planet can do. They say they might be able to by angle of pull, but you and I both know if we take a structure here and a structure here, we can pull in that direction, that direction, that direction. I'm not going to be able to isolate it right here. With a laser, if I point that laser at that area, I can isolate that tissue. So very, very specific treatment, very, very specific dosage, and a synergistic effect of a laser to soften the muscles and relax everything and stretch all at the same time. The only device on the planet that is able to do that. So that's where the spine specialist is different than anything else that any other clinic could potentially have. Our device is unique. Thank you for the question. Look forward to more of them. Have a great one.